Hi, I'm Dr. Kevin Barton. As CEO and managing partner of a leading interventional radiology and pain management group, I'm committed to exploring and providing our patients effective, minimally invasive alternatives to major surgeries. We see firsthand how these options can change lives. And today, we're going to be talking about uterine fibroids. We received a lot of comments and messages from women asking about natural ways to manage uterine fibroid symptoms. It's a topic that affects so many women, and today we're diving all the way into it. Let's start with a statistic that might surprise you. Did you know that uterine fibroids are extremely common? In fact, up to 80% of women could develop fibroids by age 50. Now, only about 50% of these women have symptoms, so a lot of women go undiagnosed with fibroids. So these are frequently seen in women in their 30s, 40s, and early 50s. Think about it this way, roughly 2 out of every 3 women will develop at least one fibroid at some point in their lives. That's a staggering statistic. So if you're dealing with fibroids, you are definitely not alone. But before we get into natural approaches, let's quickly recap what uterine fibroids are. These are benign or non-cancerous growths that develop in or on the walls of the uterus. Even though they are rarely turned into cancer, they can cause a range of unpleasant symptoms for women, like heavy menstrual bleeding and blood clots, severe pelvic pain or pressure, bloating, frequent urination, constipation, irregular cycles, prolonged bleeding, anemia, fatigue, and painful intercourse. Most of you women have asked about natural remedies that could potentially help with these symptoms, and that's what we're going to explore today in this video. When we talk about natural approaches for fibroid symptoms, it often involves lifestyle modifications and specific remedies like supplements or vitamins. So first, let's talk about diet. A healthy, balanced diet is so important for not only just your symptoms, but your overall health. It's important because what we eat can turn into low-grade inflammation in our bodies that can potentially lead to fibroid growth or worsening of your symptoms. A diet that's focused on fiber-rich foods with lots of fruits and vegetables and whole grains are a great start. Also, incorporating foods rich in omega-3 fatty acids like tuna, salmon, flax seeds, and walnuts are all known to help manage inflammation. So listen up on this one. Green tea, which contains a compound called EGCG, also has shown promise in early studies for potentially reducing fibroid size and possibly symptoms. On the flip side, if we're trying to eat foods to get rid of inflammation in our bodies, it probably makes sense to limit or avoid foods that we know cause inflammation. Processed foods, excessive red meat, and high-fat dairy are all on the top of the list. It's also wise to be mindful about alcohol and caffeine intake. Some studies have suggested a link between alcohol, particularly beer, and an increased risk of developing fibroids. There is also research that points to the benefits of certain vitamins. For example, there's been a discussion around vitamin D and vitamin A deficiencies that might be linked to fibroid risk. Next, maintaining a healthy weight is extremely important because obesity and excessive weight are major risk factors for fibroids. This is because fat cells produce estrogen, and estrogen can contribute to fibroid growth. So managing weight through a good diet and regular exercise may be beneficial for your symptoms. Speaking of exercise, regular physical activity is key. Low-impact cardiovascular exercises like walking, swimming, and cycling are usually the exercises mentioned for fat burning. Exercise can also boost endorphins, which are your body's natural painkillers, so this could help with your pelvic pain. Stress management is another area to consider. Chronic stress can impact your overall health in many different ways. Practices like yoga, meditation, and deep breathing exercises could help in managing stress levels, which might help inflammation. Now let's talk about herbal remedies and supplements. This is an area we get a lot of questions. Some common supplements include chasteberry, this is also known as Vitex, the green tea extract that we mentioned earlier, dandelion root tea, milk thistle, curcumin, which comes from turmeric, which is very popular, and resveratrol, which is found in grapes and berries. And this brings me to a very important point. If you are considering any herbal remedies or supplements, please make sure to consult with your physician or some other type of qualified healthcare professional first. It's very rare, but there are potential interactions with medications or other chronic health conditions with certain vitamins. Another approach to managing pelvic pain symptoms are treatments like acupuncture, applying heat with a heating pad, or a warm bath for soothing of your cramps. So we've talked about these various natural approaches, but what does the science say about their reliability in treating fibroids? This is where we'd like to be really clear. While a lot of women have explored these options and some may find these treatments helpful, the reality is there is currently limited high-quality scientific evidence to definitively support the effectiveness of most of these natural remedies, especially for shrinking or alleviating significant fibroid symptoms. Many of these studies that were conducted on herbal preparations, for example, have been small sample sizes on patients or just overall low-quality research. This makes it really difficult to draw firm, broad conclusions to their effectiveness when we're treating fibroids naturally. So this isn't to say that none of this works or that there's no interesting research that's being done. Some specific compounds like curcumin and green tea extract have shown some potential in preliminary studies, but overall, much more rigorous and larger scale research is needed in order to confirm the effects and how they might translate into effective and reliable treatments for fibroids. The key takeaway here is that while these natural approaches might support your overall health, relying on them as a sole treatment for significant fibroid symptoms might not lead to the symptom relief that you're hoping for. I did have an example of this just last week. A woman had told me that she had made a huge shift in her health. She got on a great diet and exercise regimen. She had lost 30 pounds, and for a while she felt a lot better, but all of a sudden her symptoms came back with a vengeance. So again, these natural remedies I think are a great idea for your overall health, and if they happen to help with your fibroid symptoms, well, even better. So to put this in perspective, I want to remind you just how serious fibroid conditions can be for some women. We see cases where women have sometimes more than 20 fibroids, or some individual fibroids that are literally the size of a cantaloupe. So you can only imagine with this kind of magnitude how debilitating the bleeding can be, the intense pain, or the pressure that these women feel in their abdomen. What do you do if these natural approaches aren't providing enough relief, or if your fibroid symptoms are significantly impacting your quality of life, or if your symptoms are worsening? It's really important to know all your options. And next, we are going to discuss a treatment you've probably never heard of. It's called uterine fibroid embolization. UFE is a minimally invasive procedure, which means it's less invasive than traditional surgery. It's performed by an interventional radiologist, not an OBGYN. Because of this, it's a treatment option that your OBGYN may not have even mentioned, but it's a very important option for you to be aware of. Here's how it generally works. Using X-ray imaging, the interventional radiologist inserts a very thin tube called a catheter, usually into an artery in the leg or the wrist. We always typically go through the upper thigh or the leg. This catheter is carefully guided to the arteries that supply blood to the fibroids. Then tiny little particles about the size of a grain of sand are injected through the catheter to block these specific blood vessels. By blocking the blood flow to the fibroids, they are starved of oxygen and nutrients, which causes them to shrink and die over time. Most patients will see significant symptom relief within the first 6 weeks after treatment. One of the major benefits of UFE is that it preserves the uterus, unlike a hysterectomy. It also has a much shorter recovery time compared to major surgeries. So most women are typically back to work in 3 to 5 days post-procedure with no lifting restrictions after 48 hours. While there will be some post-procedure cramping that needs to be managed with medications, the bulk of these symptoms resolve in less than 24 hours. Another major benefit to UFE is it has an extremely high success rate, with studies showing that 90+% of patients experience significant or complete relief of their symptoms. UFE has less than a 10% chance of reoccurrence over a 10-year time frame also. Another advantage is that UFE can treat all fibroids present in the uterus all at once, regardless of how many there are. So UFE is not always the best option in certain circumstances. There is a limit on how large of a fibroid we will treat. Our cutoff is typically about 20 centimeters, which is the size of a large melon, about this big. So UFE is also not a new treatment. This was FDA approved 25 years ago and is also recognized by the American College of Obstetrics and Gynecology as a safe and effective treatment option for symptomatic fibroids. The reason that most women have never heard of it is because it's rare for an OBGYN to actually discuss it. This is a procedure they are not trained to perform. It's sort of like asking your primary care physician to perform brain surgery on you. It's just not in their scope of practice. UFE is an alternative to more invasive surgeries like hysterectomy or myomectomy, and it's worth asking about, specifically if you're exploring all your treatment options. Check out our other videos on YouTube that talk in more detail about what UFE is, how it works, what the risk factors are, and how we compare to other surgical procedures for treating fibroids. So to sum it up, while exploring natural lifestyle approaches can be a positive step for your overall health, and they may offer some improvement for more mild symptoms, it's crucial to understand that these supplements generally lack strong scientific backing as a standalone treatment or cure, or a highly reliable treatment for uterine fibroids. The most important thing is for you to be informed about all your options. If fibroid symptoms are affecting your quality of life, please don't hesitate to seek medical advice. A healthcare professional can discuss your individual situation and help you explore all avenues, including clinically proven, minimally invasive treatments like UFE. These modern treatments can offer significant relief and get you back to living your life again. We hope this video has provided some clarity on the truth about natural remedies for fibroids and the importance of also knowing about all your effective and proven medical treatments for fibroids. If you found this information helpful, please give this video a thumbs up and subscribe for more health insights about fibroids and other minimally invasive alternatives to surgery. If you have experiences with managing fibroids or any questions, please feel free to share them respectfully in the comments below. Though please remember, this is not a substitute for professional medical advice. Thanks for watching, and we'll see you in the next video. And before you go, if you're exploring treatment options like UFE and would like to learn more, we do offer a free consultation. This can be done either in the office or virtually from the convenience of your own home. You can find a link to schedule your consultation in the description below this video. Thanks, and I hope we have the pleasure to meet you one day soon.